which baby will not survive beyond 28 days, and not give them the breath of life if he or she makes that decision. But the admission is there. We're not sure that they're not going to be born alive, so let's get feticide talked about. They're trying to do it quietly through, College of Obstetrician and Gynaecologist guidelines, but we need to be getting a conversation about that now. If you go to the next slide, please. Some of the quotes apply to through the looking glass. You can just pick these up quickly for me. This is Humpty Dumpty. Humpty Dumpty said in Lewis Carroll's Through the Looking Glass, when I use a word, it means just as I choose it to mean, neither more nor less. And Alice said, but the question is whether you can make words mean so many different things. And Humpty said, the question is which is to be master. That's all. Now, the language that is being used now is concealing the realities, and it's your responsibility, each and every one of you, not to let this happen. Challenge the language, but never hear it. So, Dr. Noreen Russell, an obstetrician, in talking about feticide, has talked about this being done to stop the baby's heart and ensure it is born sleeping. Does she think we are idiots? Does the Emperor have any clothes on? I mean, come on, the whole point of the injection is to make sure that the baby is dead. Let's be... What is wrong with us today? Have any of you noticed? People don't die anymore. They pass. Where do they pass? I mean, I don't understand it. Can we not just call it like it is? Babies will not be born sleeping. The objective is to make sure that they are not born alive. The next one. Simon Harris. He cannot tolerate anymore, he said into the Dáil in March this year, a law that forces families to travel to another country and bring home the remains of their lost child. I'm sorry, lost? Concealing a reality. I know we must be compassionate to families who go through this. I know it is horrendous. But should we allow the public discourse be twisted in a way that we must somehow that nothing has happened by agency of adults here? These children aren't lost, they have been terminated. Deliberately by doctors. In the same speech, Simon Harris said that his intended legislation effectively puts a ban on late-term abortions, and he said the spectre of late or full-term abortions is not the reality. That, ladies and gentlemen, is a lie. I cannot put it more clearly than that. Right, the legislation is ignoring the realities, so let's put them all up here. Fetal pain has not been addressed. I've already told you that fetal pain, there is enough doubt out there that it can be felt from 18 weeks to mean that we should be doing something about it. And we should insist that TDs face up to their responsibility. If they're going to make the service available, they've got to address the dirty business too. On average, every working day in the UK, one well-developed, after 24 weeks, unborn baby will be killed by lethal injection because apparently it has a disability. Every working day in the UK. What's going to be done here? They can't do it both ways. Either they're going to have live birth or they're going to engage in feticide. They have to face up to the reality and take responsibility for what it is the people have voted. The other thing we've got to look at is the law is so far behind the curve on this, it's rather shocking. The conscientious objection that has been allowed is very limited. It's not a conscience right at all. It's bare tolerance of the fact that doctors may not want to engage in this. And it is ignoring completely the new medical reality that most abortions will take place medically, as in with prescription of drugs and trips to the GPs. This has been rolled out in Scotland and so far is under the supervision of local hospitals where it's being done. Here, there's no provision for that in the legislation, it's just GPs. Now, GPs, at the moment, 83% of abortions in Scotland are done medically. 67, nearly 68% in England and Wales. Now, I know that Peter McKenna obstetrician indicated in one of the newspapers over the summer that he expected about 18,000 abortions initially a year in Ireland. 40% of which he said would be surgical. 40%. We have to see that the vast majority of abortions are going to be carried out on prescription of drugs to be given out by pharmacists and doled out to patients by GPs who are willing to involve themselves with this service. And yet, the pharmacists are not being given any right to conscientiously object, and that is wrong. And you have to resist that. So, conscience rights. You'll go back. Thank you. So just three things there. Who has them? Well, hospitals don't have them and clinics don't have them according to this legislation, and that's not on either. There is a assisted institutions have also got to be afforded conscience rights, which are really more of a recognition of preservation of their ethos. If a number of doctors in a clinic, if the doctors don't want to do the proper procedures, why should the hospitals be forced to do them either, or forced to provide them? What is participation in termination of pregnancy? Does it, for instance, allow a doctor to refuse to certify that a woman falls within the categories of permitted terminations in the legislation? It should do, but it doesn't. We need to insist on that kind of detail. And then, of course, there's the duty to refer. Now, I'm sorry, but for most people, if you believe, number one, you are a doctor and it has nothing to do with conscience, you're looking at this woman and there's no clinical reason why you think she should have an abortion. In fact, you think it would be harmful to her. You know this patient for a long time. And you think that this would be harmful clinically. Well, that's a clinical decision. You don't have to appeal to conscience at all, as far as I'm concerned then, but these will give rise to test cases in the courts, just wait and see. But if you are going to be told you must refer to a person, then you are implicated in the service that's been given. You are being coerced into providing this referral. And what we are suggesting is look to other countries, look to New Zealand legislation, where all the doctor has to do in that situation is simply say, look, you can get this service from the local health clinic or from another doctor, and that's it. Say no more. And the government did say initially this is going to be an opt-in system where women would easily be able to get a list of doctors or areas that they could go to or websites they could consult in order to find the service. If that is the case, then there isn't going to be a difficulty in getting an abortion if you want one. There is no need to have this coercive conscience objection. And I'm going to say to people, let's stop talking about conscientious objection. A lot of the academics are calling it dishonourable disobedience now. You're not allowed to have conscience. It has nothing to do with religion. You can have religious belief that is supporting your conscience, but you can have a conscience without any religious belief at all. And we must call them conscience rights. We want protection for conscience rights. This legislation is critically important on this because it's going to provide a template for future legislation on assisted suicide and euthanasia. We have to get this right. And we don't know what the numbers are. We don't know if Simon Harris is working off 18,000 people having abortions a year. I doubt it, looking at what I think it was Patrick Leahy published last week in the papers. He said the GP-led service will cost approximately $5 million a year. Hospital abortions, which they say, but it's not in the legislation, will be for every woman who is pregnant beyond 9 weeks, will cost approximately $7.35 million each year. And as I said, we're not sure what the numbers are. We need to be pushing the TDs and being, just let's not make this easy for them. They are trying to ignore you still. You are nearly 1 million votes in the country. Make your voices count. We're having a conference, and most of you, and by the way, Martin and John was down there, I'm really sorry I didn't get to Limerick last week. You can hear that I've had laryngitis for a couple of weeks. Still shouting about all of this. We are not going away. Why would we go away? There is so much to do. We have to monitor the rollout of this legislation. We have to monitor the amendments. We've got to see how it's being used. We've got to see how we've got to minimise the detrimental impact of this legislation. We have to persuade people to our way of thinking. A lot of people who voted yes are unhappy with some of the fine detail that's now coming out. We have to educate the younger generation. We have to bring them back, as I was brought back, by education in 5th and 6th year in school, by women who went around Dublin with photographs and videos and information on abortion that was just truthful information. We have to educate the new generation that there are better choices than abortion, and there's no reason that a woman needs to have one. It's not medically necessary. It may be socially wished for, but it's not a medical necessity to address any complication of pregnancy. And there are enough supports out there to help women look after unwanted pregnancies and the babies that they have. And we have to continue to assist groups like One Day More, groups like Gianna Care, the Medico Legal Alliance, the people we have assisted and worked with for many years, and most particularly during and since the referendum that we had earlier this summer. So that's why we're staying around, and we're continuing to volunteer and get involved. And why must we now have hope? Well, there's every reason for hope. Do you think Diarmuid Alton went away after 1967 in the UK? He didn't. He stayed with politicians and fought to bring back